So when was your mini gastric bypass done?
It was 2.5 years ago.
2.5 years back. Okay. So what change you find after the surgery if you compare yourself before surgery and after surgery?
Before surgery, I was kind of heavy, and we always, being shy to go out and that kind of stuff.
Mm-hmm.
Big, and life was terrible. Now I feel way better. Easy breathing, easy life.
Earlier you had some snoring problem while sleeping. You used to snore.
It was big time.
Big time snoring. Okay. And how is it now?
I don't snore anymore.
You don't snore anymore.
No.
So this is sleep apnea. Sleep apnea is gone.
Yeah.
And any other thing? You had diabetes or something? No.
I don't have diabetes.
You didn't have diabetes.
I have asthma problem.
Asthma problem. Okay.
That's
And
gone on.
that's not there.
No,
Okay.
I don't take
No
any-
breathlessness.
No.
Okay. How much weight did you lose after surgery?
I think what 70 kg probably.
70 kgs.
Yeah.
Okay. So it has been like 2.5 years. And you also gained some 5-7 kgs.
Well, it's not like I gained the weight because it's of my own fault.
No, but that's right. But we must understand.
Yeah.
Because we must understand this surgery. We cannot put a lock inside that we cannot fix the weight like it will stay here. No. It needs some kind of maintenance. And the mini gastric bypass has got the minimum maintenance. Like a very good car, it has got minimum maintenance, but still it needs some kind of servicing or something. So what you need to check is you should not take any sugars, just avoid sugar. Sugar is like poison.
Okay.
And it gives you a lot of calories.
Okay.
And then, what is your capacity? How much you can eat in one go?
Maybe.
If you compare like before surgery and now,
I would say before I eat like 5-6 chapatis.
5-6 chapatis you could eat. And now, how much you can eat?
2.
2 chapatis make you full.
Yeah.
So this is what we see with mini gastric bypass. Even after 2.5 years, like in your case, we have patients who are 7 years down, and still they say that they are eating 2 to 3 chapatis.
Yeah.
And there is some concern about the dilatation of the pouch after surgery. It can dilate. So the patient has to be slightly, you have to handle this slightly intelligently. Don't try to eat too much. If you keep on eating too much, then the pouch can dilate. So like in your case, the capacity is almost like a normal person.
Yeah.
You can eat 2 chapatis,
Yeah.
like 1.5 slice of pizza,
Yeah.
you can take.
Yeah.
And that will give you some strength. You can eat vegetable, you can eat chicken.
Chicken.
So yeah, this much of capacity we see is required. We give a moderate size pouch so that the patient has got some luxury to eat. Only then you can select some healthy food for you. And do you feel any weakness or any
No,
kind
I'm
of
fine.
problem
I don't
afterwards?
have any weakness.
No weakness at all?
I work like
Yeah. So this is the strength of gastric bypass. You have lost weight and still you feel fully energetic, no weakness.
No.
What is the reason? How many tablets of multivitamins you are taking?
I used to take 3, like calcium, multivitamin, and
Okay.
iron.
How many now?
I used to take 2 times a day.
2 times a
Now
day?
it's once a day.
Now you are taking once a day.
Yeah.
We have patients who are not taking any vitamins at all. In Punjab, about we can say 30% of our patients are not taking vitamins. So what are the vitamins doing inside? If you are taking healthy food, that is like 95% of the job is done. 5% we have, still there are some chances that your hemoglobin, your iron or calcium can go down. For that, now we are just giving 1 tablet of multivitamin every day to our patients.
Okay.
Earlier we used to give 3 tablets. But over a period of time, what I have learned is that it is your diet which helps. If you are not taking healthy diet and you are taking 3 tablets of multivitamin, it will not help. So did you get your blood work done? How was it? Anything came down? Or
I think there's no cholesterol or anything.
no cholesterol. Yeah, cholesterol is essentially normal after this. And what about your hemoglobin, calcium, everything is within normal limit? What do your doctors say there?
He says everything is fine.
He says everything is fine. So that's good. Do you drink? Take some
Yeah,
alcohol? Little bit?
Sometimes, yeah.
Sometime?
Yeah.
1 pack, 2 pack, or like 4 or 5? Or
2, 3.
2-3 bags.
Feel too good.
It's like once in a week,
Twice a week sometimes.
twice a week. And any nausea, any vomiting,
If I overeat, of course.
if you try to overeat. Otherwise, no nausea, vomiting. So this is one good thing which I like about mini gastric bypass is it gives you some luxury to eat and without any nausea, vomiting. And if you try to overeat, then
That's all.
yeah, but still you can eat 2 chapatis or 1.5 piece of pizza.
Yeah.
So that is good, and without any weakness, without getting your hemoglobin and calcium down.
Yeah.
But still, you have to be careful. Get your blood work done once in a year, and keep on taking the multivitamins.
Okay.
Don't take sugars. Do some exercise.
Sure.
That's a must. If you want to maintain like this,
Okay.
at least do 10-15 minutes of treadmill, or you can do some jogging or cycling. So that should be like regular. All right.
I'm happy and
Good, good,
thank
good.
you. Thank you.